Hello, everybody. Good morning, good afternoon, good evening, whatever it is, wherever you are. I am Dr. Alfred Marquez at Marquez Integrative Dental Care of El Paso, here in the big state of Texas. So today we are doing Fun Fact Friday, but one of the things I want to tell you, let's talk a little bit about ourselves. Our goal is 5-star care for all our patients. I've got a wonderful staff that helps me accomplish that. And I'm very proud to say we've got lots of 5-star ratings. And I encourage you and invite you, should you be looking for a dentist, to come visit us. Today's topic, osteoporosis. What's a big deal and how can it affect our dental health? I want to go over this with you because there is questions that come up about osteoporosis. The answer, can it affect your teeth? Well, not directly. Let's start with what is osteoporosis. A condensed explanation would be that it's a reduction of the bone mass and also the architecture of our bone so that it becomes more fragile. It seems to be more common in women than in men, and the concern is fracture of the bones. In a nutshell, that's what osteoporosis is. It's estimated that 1 in 5 adults have osteoporosis. What's a big deal dentally, and is it a concern? Can it cause the loss of bone around the roots of our teeth? Will they get loose because we're losing bone around the teeth? Well, not directly, and that seems to be the consensus at this point. It could change. It does result, however, in less dense bone, which then makes it more susceptible to the breakdown of bone, which occurs when we have periodontal gum disease. This inflammatory response will break down the bone. It's caused by different bacteria that begin to be more invasive to our gum tissue, causing inflammation and subsequent bone loss. Be sure to check out our videos on periodontal gum disease and get more information on what gum disease. In short, periodontal gum disease destroys the support of our roots. It's estimated, listen to this, it's estimated that 50% of adults over the age of 30 have some form of periodontal gum disease. 70% of adults over 65 years of age have periodontal gum disease, and it is the leading cause of tooth loss in adults. Now, going back to osteoporosis, again, very common. It's being treated by different medications. We've got Fosamax, we've got Iridia, we got Boniva, we got Actonel, we have Skelid, we have Dronel, we have Zometa, and then there's also IV forms of the medication such as Zometa, Iridia, Bonfos, just all kinds of stuff that people can take in effort to control osteoporosis. Now, the problem with these medications, which are termed bisphosphonates, are the side effects. Like anything else, anything we take, there are side effects. In dentistry, in particular, what we have to watch for is what's called osteonecrosis of the jaw. It's a condition where bone lesions that develop, they're very slow to heal, and sometimes they never heal. And this can result from dental surgery, very unique to just the jawbone, even from trauma For example, like in the case of a poor fitting denture, it can traumatize the tissue and you will develop those lesions, possibly. Now, fortunately, the risk for osteonecrosis is low, and it maybe is about 1% of the people taking the medication. It does increase as you take the medication longer. In other words, the longer you take it, the more potential you have to develop the osteonecrosis of the jaw. That being said, you need to let us know if you're going to start on these medications so that we can guide you as to the precautions that you might take to prevent these problems. For sure, have a discussion with your medical provider. Evaluate the pros and cons of bisphosphonates that are prescribed to you. Look at the side effects and see if indeed this is a good fit for you. Do your research, do your due diligence. One of the things I observed, this is my personal observation, let's say 10 years ago, I noted that probably, I would say a big percentage of my female patients over the age of 50 were placed on bisphosphonates. The idea being that they wanted to prevent the problems with this issue, osteoporosis. You know, my take on it, and this is my personal thought, is that it was kind of trendy. Pharmaceutical really pushed it on, and they were making it seem like a quick fix. You know, I'm sure there was profits in that were made. I could be wrong. But anyway, like anything else, prevention of the problem is a key. So what kind of things? Healthy lifestyle is awesome. Exercise, nutrition, sleep. There's been literature that comes out on the use of vitamin D, calcium, and vitamin K2 combinations that are recommended for the prevention of osteoporosis. But you need to speak to your health professional before you start dosing yourself, not dosing, dosing yourself, and you know, just do your diligence, do your research, and hopefully this will not be a problem for you. If you have any questions at all, I welcome you to contact us. I hope this information is helpful. Be sure to follow us for future Fun Fact Fridays. Any topics that you want to hear us talk about, let us know. I'd be happy to address them. Follow us, please, on Facebook. Follow us on Instagram. Follow us on our YouTube channel. Lots of great information. Our website, marquezdental.com. And we're more than happy, as I said, to welcome you as a patient here in our practice. I am Dr. Alfred Marquez, wishing you a blessed day. Thank you.